Hello, I'm Joseba from Tenerpelo in collaboration with Besser Clinics. We're going to interview Dr. Kerim from Vera Clinic. The objective of this interview is to know how the clinic helps the patient to have excellent results, and later we will resolve some general doubts. Okay, Dr. Kerim, what makes your clinic different from the rest of the clinics?
As Vera Clinic, this clinic has been in the business for more than 14 years now, and we have a highly experienced team which consists of extraction team, the incision team, which are doctors, and the transplantation team. And regarding this process, we train our staff very well, and our teams are specialized in different kind of patients. For example, for Afro patients, we have a team that are experienced in these patients. For example, patients from Scandinavia, their hair structure is a bit different, their donor is a bit different, and our extraction team, incision team, and a transplantation team are expertise in this various type of ethnic groups. And we follow the newest techniques, newest improvement developments in this sector. We try to utilize them as soon as possible in this clinic. For example, when it comes to Sapphire FUE method, we are a pioneer. We were one of the reasons, maybe the most important reason, that this technique, Sapphire FUE technique, is that widespread in Turkey.
Can you tell us a little bit about your team?
As I told you, we have more than 40 workers here, and this group has some doctors, some nurses, technicians, and transport staff as well. And the extraction team is different, our incision team is different, especially the incisions are done by doctors in this clinic, because we make the incisions according to the natural direction of the hair. So it's a very precise process, it needs to be perfect, and therefore the incision part is done by doctors. Then we have a transplantation team as well, and they do the transplantation of the grafts into those tiny incisions. So as a group, as Vera Clinic, our team is highly experienced and they've been working here together for so long. So that's why we do not waste any times in between stages, and we are so organized. Yeah, I can say
okay,
all of
very
that.
Interesting. What rate of hair survival do you have in your transplant operations?
In Sapphire FUE method, the survival rate is approximately 95%, but in this clinic, our survival rate is more than 98%.
What methods of hair transplant do you use in your clinic?
In this clinic, we employ Sapphire FUE method and DHI method.
Okay, and what is the difference between both methods?
In Sapphire FUE method, there are 3 stages: extraction phase, incision phase, which is done by doctors in this clinic, and transplantation phase. But in DHI, the extraction phase is the same, but there is no incision phase. The incision phase and the transplantation phase is done together in DHI method.
Which method is more suitable for which patient?
In DHI method, we shave only the donor area. We don't have to shave the recipient area. So DHI method, we suggest to our women patients who doesn't want their hair to be shaved, and patients who needs less than 2,000 grafts, because this process takes long time. It is done by one person. So in DHI method, patient needs less than 2,000 grafts. But in FUE method, we suggest to our patients who have good donor area and who needs a lot of grafts, more than 2,000 grafts.
What is the maximum number of grafts do you usually do with a Sapphire with good donor area?
It highly depends on the donor area, the quality of the donor area, and the density of the hairs in the donor area. So if our patient has an excellent donor area and a large bald area, we can even extract up to 5,000 grafts.
What other methods do you use, also the hair transplant for your patients?
In this clinic, we also employ PRP method and stem cell method and regenerative method.
Can you tell us a little bit more about the stem cells and regenerative?
In stem cell method, we extract fat tissue from the belly, we process it, then we inject it right under the scalp. When it comes to the regenerative method, we extract stem cell tissue from right behind the ears, We process it, then we inject it right under the scalp. And these two methods, since they consist lots of growth factors and stem cells, they are highly beneficial for the scalp and the hair.
That has been very interesting about your clinic. Now I'm going to ask some general questions of the patients.
Okay.
What is the most common reason to fail in an hair transplant?
In hair transplantation, the donor area is highly important. So if a patient has a weak donor area, then he or she should keep their expectations low. Mm-hmm. So if a donor area is weak, then the success rate of the operation, of course, can be weak.
Do you have any advice for the patients to avoid bad doctors and clinics?
Mm-hmm. My advice would be to do their research, have at least some second opinion, and adopt the clinics that accept every wishes they had, because it is an aesthetical decision, but also it is a medical decision.
What is the most important factor in the survival rate of transplanted hair?
There are some intraoperative factors and extraoperative factors. When it comes to intraoperative factors, the duration that the graft spend outside is very important, and in this clinic it is very minimal. And when it comes to extraoperative factors, we have some suggestions, some instructions for our patients, especially about the aftercare. If our patients follow our instructions, for example, use their hats to prevent sun exposure, rain exposure, and do the hair wash according to our instructions, I'm sure the survival rate will be high.
What do you think about BHT from beard and chest?
In this clinic, we do transplantation from beard, but we do not do transplantation from chest, because those are two different hair types, and the survival rate of the chest hair is lower than the beard hair. But when it comes to beard hair, since it's a bit thick, we utilize these grafts on the crown area especially. We mix it with the donor area grafts, then we distribute it well, and the beard hair provides us a good density on the crown area.
How do you see the future of the hair health?
When it comes to Sapphire FUE method, the donor area is extremely important, and if a patient has a weak donor area, that means that the amount of graft that we can extract is limited. But if we can achieve the graft cloning, which nowadays the trials is done, especially on this area, then we can overcome this problem, and even patients with weak donor area can have very successful results.
What do you think is the most important for a natural front line?
When we are designing the frontal hairline for our patient, we take into account the age of our patient, the status of the donor area of our patient, and of course their wishes. And we also check the muscles on the forehead area. So when we are designing, we take those three situations into consideration, and we transplant the single hair follicles on the first two lines of the frontal hairline. Going further back, we transplant doubles and triplets and quadruples, and this provides us a natural look.
Okay, thanks, Dr. Kerim. That has been really interesting.
Thank you as well.
Excited about this clinic. The people is very professional and they give me a lot of trust.